Many of the proton centers that we design include some level of research. Some is pretty elaborate, while others is very modest. And so when we start to talk about research, there's always a question of what does that mean? What does it look like? There are some research elements in proton centers that are no more than a 200 square foot room. There are other examples, like a project we're doing in San Francisco right now, where research occupies a significant portion of the floor. And that's serious research. And some of these more elaborate research elements include vivarium, and that comes with its host of issues and code requirements and limitations. And we have to take that into consideration when we're planning out the overall building. So research can be small or large, it can be elaborate or modest. It often is a driver in how we plan out the building, how you bring your research elements into the building and exit. And can they overlap with the same pathways that patients use? These are all considerations and occupy a lot of conversation early in the planning of a proton therapy project. Research might be just dry research, physics research versus biologics, wet labs, and things like that. Some proton centers allow other third-party research entities to come in, say on the weekends when they're not treating patients, and use beam time to do experiments, maybe in an experimental room. And there are things that we have to build into the plan to accommodate that as well.